We get a lot of questions and queries about non-surgical facelifts, and patients often ask us what a non-surgical facelift is versus a surgical facelift. So let me try and explain some of the myths around non-surgical facelift. So often patients think, well, how can you lift a face with fillers? You actually need surgery to lift a face. But one of the key aging changes that's occurring in the face is a volume deflation. So the face is actually just deflating. It's not moving southwards due to gravity. So by restoring the volume in key locations and restoring it anatomically in different layers and different planes using a plethora of different products, you can lift the face and sculpt the face naturally. So a non-surgical facelift is appropriate for any person above the age of 21 who wants to restore back volume in their face. But clearly, if you do have true tissue laxity, you would be better off having a surgical facelift, and therefore you do need a consultation with me where I can assess and make the best recommendations to you based on your own individual characteristics of aging. So typically what would happen is, after taking a detailed history, I would do a facial assessment. I often use tools like the Harmony Compass to just check the different ratios of the face, the symmetry of the face. Patients always ask me, how much am I going to need? And they get a bit concerned when we talk about 5 mils of filler in the face. But a mil of filler is really nothing. 5 mils is a teaspoon. So you can imagine that if we have to create these natural silhouettes and support, we are going to need a fair amount of volume. But we place this volume very strategically so that it does not morph your face into something you're not, but we're creating these natural silhouettes. We're making you look natural, and none of the filler is actually visible. Some of the key areas of support that I give is in the temples, the lift points at the outer arches, the angle of the mandible at the jawline to support the jawline, and definitely then we very gently pepper the central area of the face, which is the tear trough and the perioral area, to just soften and correct volume loss in these areas. So the next question patients ask me is, how long is the filler going to last? And typically it will last you anywhere from 6 months to a few years. So these procedures are typically painless. The filler has got a local anaesthetic in it. In addition, I use a topical anaesthetic to numb the skin to make the procedure as comfortable as possible. There's a small risk of bruising, and clearly there is a risk of swelling because that's how the filler acts. It absorbs water and swells, but the swelling typically will settle down in a couple of days. So I hope this little video on non-surgical facelift has helped address any concerns you may have about this kind of transformational facelift, which doesn't involve any scalpels or theatre time. And if you have any further questions, please don't hesitate to contact my team at Perfect Eyes Limited.